need from the people making a difference. This is Comcast Newsmakers.
Hello everyone and welcome to Comcast Newsmakers. I'm Barbara Rogers. We're on location today at Covenant House, California. It's a program for at-risk and homeless youth. Joining me now is Steve Bischoff. He is the Executive Director of the Mental Health Association of Alameda County. Thanks for stopping by.
Thank you.
Well, mental health, this is of course always with us. You have been the Executive Director at Alameda County, at the Mental Health Association of Alameda County for a long, long time.
Long time, right.
Is the overall situation getting better or worse in terms of the number of people that are in need of mental health services and also in terms of how we're able to serve them?
I think probably the number in need hasn't changed tremendously. It's hard to know sometimes because people will report, there are a lot more people with X diagnosis, but then sometimes we're better at catching a diagnosis now than we have been. It doesn't matter in one way because up to a quarter of the population really has a mental illness at any one time. So we're talking about a whole bunch of people.
That is a whole bunch of people, a quarter of the population.
Yeah, ranging from 1% for schizophrenia to up, almost 20% for anxiety disorders. So that we're talking about a whole bunch of people. Now, in terms of what's available to serve them, things have really improved on the one hand and gotten worse on the other hand. When we look at Alameda County, for example, we have statewide, we have Proposition 63, the Mental Health Services Act, which provided extra funding for programs designed to transform the system, help people in ways they weren't being helped. And as a result of that, Alameda County has a whole bunch of good new programs. One of ours is the Family Education Resource Center, which you'll talk more about. And also we're involved in one that is involved in reaching out to try and intervene with people who are early in psychosis, people between 16 and 24, because if you can do that, oftentimes you can really help them and sort of stop the course of the illness. But so there's all kinds of exciting new programs. At the same time, state funding for base programs has basically not increased or even gone down. So what's happened is, the basic services are sort of getting cut. There's some new services on top of it. So there's some, good new stuff. But sometimes if you needed the other services, they're just not there as much as they could be.
I think a lot of families are confused as to what they can actually call on the Mental Health Association to help them with.
Right.
What can you kind of give us just an idea of the kinds of situations in which they would call you in?
Sure. We try to do things to help people with mental illness directly. We have something called the Mental Health Advocates Program, which is our oldest program, that helps people who are disabled by mental illness to get financial benefits mostly that they need in order to survive in the community. That same program can help people find other services and deal with other kinds of situations. We provide patients' rights advocacy. We go out to the various facilities in Alameda County, especially the locked facilities, to make sure that people understand why they're there, what they can do about it if they don't like it, and that they're treated with respect, because that's something that sometimes doesn't happen in the mental health system. And we're also the official sort of complaint line for Alameda County for people who are getting services who aren't really happy with the services provided, so they can call us about that. Then on the other side, there are a whole bunch of services for families, the Family Education Resource Center, which we won't talk more about right now because you're going to talk about it later, but also the NAMI Alameda County, which is a local affiliate of the national organization NAMI, which has regular educational meetings and helps people with support groups and so on.
Is there a fee for these services?
None of these services have fees.
So people who are in need of services call you or go to the website?
Right.
And do they get assigned a counselor?
Well, we don't really have counselors per se. I mean, in what we mostly have, we mostly call our people advocates, basically. And because what they're supposed to do is help people navigate the system, understand how it all works, and help speak for them if that's essential. But we don't provide any actual mental health services at all.
Okay.
So.
Well, thank you so much, Steve Bischoff, for coming in and telling us about the mental health services available in Alameda County.
Thank you.
And thank you for joining us for another edition of Comcast Newsmakers. I hope you'll be with us again next time. Bye-bye.